Hey everybody, and welcome to today's video article. Those of you who have been with me for a while know that I used to shoot all of my articles through video, but we switched to the written format because it was more convenient for everybody to be able to look at it in situations where they couldn't turn up the volume. So today I want to go back to the video format because it's going to be easier to explain the point through video. So basically I've been talking about low back pain and the injuries that happen and how over time things get progressively worse through degeneration. And I want to give you a visual, kind of a pictorial example and representation of how that process happens so that you know kind of what I was talking about. So excuse the technically advanced techniques used in shooting this video, but I'm going to turn the camera around, I'm going to explain to you and show you a diagram that helps to explain this. And this is also a very messy desk, so bear with me. Okay. So basically what will happen is we'll have some sort of injury that'll happen to us. It could be a physical stress, or it could be an emotional stress, or a chemical stressor, but it causes some kind of a structural issue in the body. And what will happen is over a period of time, that injury will start a degenerative process. In other words, it'll set into your body, but it'll heal incorrectly, and it'll cause degeneration to start to occur in the body. Now, the first thing that usually happens is we'll start having some malfunction. So, for example, we'll use your low back as an example. Malfunction in that might be an example of you're not able to bend or turn as far as you used to be able to, or you're not able to, maybe your bladder's not working as appropriately as it used to. Maybe your urine flow drops a little bit, or maybe your hormones start to fluctuate a little bit, or maybe you start having a little bit of leg weakness, that you're not really noticing. But these are little things that the malfunctions can happen without us actually feeling the consequences of it. As the time tends to proceed, we get into a state of what we call dis-ease, and that's where your legs are getting weaker and weaker, and you just don't feel right. Or with the bladder, for example, things just don't feel right. Things just feel off, but again, you're not having clear-cut symptoms. And then what will happen is eventually, after we've gone through this process and enough time has elapsed, we'll have a crossing of what we call the pain threshold. There are only a limited number of nerves in our body that actually feel pain and actually sense painful sensations. So we have to go through this whole process to get to that tip of the iceberg where we actually start hitting that pain threshold. This is why so many times somebody will bend over to pick up a shoe and their low back will go out. Or in my instance, when I had my back surgery, I was bent over and I was playing tug of war with a chihuahua off of a couch and my disc blew. It wasn't that chihuahua that did it. It was the injuries that I had sustained when I played football, and then over time they had gotten worse and worse, and then finally bending over and playing with that chihuahua caused me to go through that pain threshold. So now you're into the world of symptoms where you're having the acute pain, and this is usually where we end up seeing people. Okay, so there are three ways that you usually heal when you're dealing with a symptom. The first way is you might actually get a little bit worse as we start changing your structure, and then it'll turn around and you'll start moving towards pain relief. The second way is you may not notice anything very much in the beginning, and then you'll start noticing the improvement. And the third way is that you may start noticing an improvement immediately. But whichever way you go, about 90% of the time we'll end up getting you back up to where we're crossing back over that pain threshold, and you end up not having the pain anymore. Now here's where the choice comes in. And this is where most people get the rumor that once you go to a chiropractor, you have to always come back. You have two choices. Once you've crossed that pain threshold and you feel better, you can stop care or you can continue care. If you continue care, then our goal is to move you as far up this functional recovery as we can and get you as close to 100% function as we can possibly get you. The way that we do that is through stretching, rehab, structural reintegration, postural exercises, all kinds of different things that we do to try to get you up that functional pathway to get you to where all these systems that were going on over here have started recovering. And what will end up happening is your body will feel better, you'll heal quicker. If you do have an injury, it'll go away faster. Your body is just in a better state if you go this route. Now, what some people decide to do is they get out of that pain and they decide to stop. Okay, and that's absolutely fine. We call this patch care, because what happens is this is a temporary fix. You'll hover above that pain threshold, but remember the whole theory of entropy that I talked about in the other article, where the body's tendency is to move towards chaos? Well, as you're hovering here, your body's going to move towards chaos and you're going to come back down through that pain threshold. You'll come back in, we'll patch you up again, and it just kind of starts this process, okay? But notice that when this malfunction is still here, because we haven't fixed the malfunction, this is where the degeneration occurs. So these pain cycles will become sooner and sooner, they'll happen quicker and quicker, and they'll get harder and harder to fix, because now we're not only dealing with a pain cycle, we're also dealing with a degeneration that's occurring. So this is the process of degeneration right here. If you choose this pathway, you get up to a certain level, and the law of entropy still applies. So let's say that we get you to 75% function. I'm doing this left-handed, so bear with me. Well, then we're going to put you on what we call a meaningful maintenance plan. And what's going to happen is, in between your adjustments, your body's going to tend to start moving back down this way again. This is really weird writing through the camera. But what will happen is, about whatever your meaningful maintenance plan is, we're going to adjust you right here. Boom. And that's going to take your function back up here. And then you're going to start that process again. So your roller coaster ride that happens here is going to happen here, but it's going to happen up at this level. So we're still in as normal function as possible. We're not in the degenerative phase, and your body is maintaining a much healthier state. And this is the same thing with exercise. You know, when you exercise, when you work out, you finish your workout, and you know, once you've recovered from that workout, your body starts moving back towards weakness. So you work out again. And it's the same thing with working out, with cardiovascular exercise, with your marriage. You give your marriage a lot of attention, you get it up to good function, you start ignoring it, it's going to go down, you maintain it. Same thing with your brain function, same thing with everything in your life. Entropy will occur, but you have to maintain it, you have to give it attention. So it's your choice when you're coming in for treatment, whether you want to stay down in this area and deal with possible degeneration, which will cost you more money and more time and more pain in the long run, or if you want to come up in this area and face entropy, but you maintain it at a higher functional level. So I hope that makes sense. I hope that explains the theory behind what we do, the theory behind trying to actually fix your back pain versus using pain meds. Here's the example in pain meds. You know, if you got the pain meds, they come in here and they block your body's symptoms or they block your body's signal for the symptoms. So you're still down here, you're still degenerating, you're still, even moving further down this pathway. Your pathway's going down here, but you're just not feeling the symptoms because you're blocking that signal. So that degeneration is occurring, the malfunction's occurring, all the problems are occurring with no solution in place. And then when you finally realize, hey, these pain meds aren't working for me, and you come in and see us, you're way down here. There may be too much tissue damage for natural procedures to help you. You might be stuck with the options of pain management and surgery at that point. I had a very, very intelligent patient come in the other day, and she had a foot injury. And she had been reading these articles, and she came in and we treated her foot because she did not want to have this happen to her foot. So she understood that this is not just for the low back pain. This is for every joint in your body. This is for every symptom in your body. Headaches, car accidents, any of these things follow this same pathway. Car accidents, it's very interesting because they will start here and you get the injury, but you shoot down here a lot quicker because of the increased trauma. You go through malfunction and disease, and you got your malfunction, your disease, and your symptoms all in one big traumatic event. So then as your body starts to heal, if you don't heal it structurally, it's going to go down this pathway and cause a lot of problems in the future. So, all right, well, I hope this helps. I hope y'all find this very informative, and tomorrow's article is going to be very, very cool. I have actually been going to the Gulfarium, not to the Gulfarium, to a vet's clinic and adjusting an otter that is at the Gulfarium here in Fort Walton. And tomorrow morning I'm going to be going in and adjusting the otter again, and I'm going to have my daughter shoot a video of it, and we're going to post that on the blog tomorrow. So look forward to tomorrow's email, and assuming everything goes right, you will get to see an otter getting adjusted. Have a great day. See you next time. Bye-bye.